Hello, I'm Francesca Carubbi, a medical doctor from Italy, Modena University. I'm a faculty in metabolic internal medicine, and I'm head of a lysosomal diseases regional referral center in Modena, in Italy. And I'm here today to report and share views and experiences of the community affected by lysosomal storage diseases in Italy and Europe. And my disclosure is that I've been member of scientific advisory boards for Sanofi and Takeda, but I have no conflict of interest today. And my agenda will be try to recognize the global impact of COVID-19 pandemic on patients with lysosomal storage disorders, particularly to understand patients' perspective and their experience during the pandemic, evaluate the healthcare system response in Europe and in Italy, where I work, to patients' need. Cumulative COVID infection 19 cases as for June 2020 show that this is really a pandemic. More than 8 million confirmed cases in the world, more than 500,000 confirmed deaths in 216 countries. A main problem that starting from China and spread suddenly to Europe, and mainly the first country in Italy, northern Italy, where my hospital in Modena is located. From this big red balls, you can understand the great disruption of our system because of the COVID-19 pandemic. But the COVID-19 pandemic is not over yet. So my questions are patients with the lysosomal disorders affected by SARS-CoV-2 disease? How manage patients with rare lysosomal diseases during the COVID pandemic? And after the lockdown, now that we are relaxing the confinement phase and measures, which health measures for the rare disease community? So the problem is that the COVID-19 pandemic has exacerbated the many challenges people living with a rare disease already face in their lives, and has created extra risks in their daily lives with several consequences. Rare disease patients are experiencing interruptions of the usual care, at least in Europe and Italy, because of the problem that overwhelmed our hospitals. The pandemic triggers a strong feeling of anxiety among patients and their families. So the vulnerable patient with the lysosomal storage disorders need attention, protection, mindfulness, and special efforts for health and social cares in the next post-confinement period. Well, from a survey that Eurordis took in Europe, because Eurordis Rare Disease Europe is a unique non-profit alliance of more than 900 rare disease patient organizations from 72 European countries, supported by the European community, bringing together all stakeholders and communities to improve the lives of people living with a rare disease in Europe. Let me say a sentence out of the survey. The COVID-19 pandemic had a collateral impact on the health and quality of life of the 30 million people living with a rare disease in Europe and in the world. And I report a female patient comment saying, what is the patient experience during the pandemic? We no longer have a follow-up with the nephrologist concerning the transplant. The meeting has been canceled. The last blood test was taken and should be taken every 2 months, and it was taken a long time ago. Psychological and psychiatric follow-ups have been canceled because there are no any consultation in the hospitals. So the problem is particularly in the hospitals. Interruptions in cares have a detrimental impact on patient health. 6 in 10 patients declare that interruption of cares was detrimental to their health. 7 in 10 declare the experience of a worsening of their well-being and perceived the interruption of care as life-threatening. 6 in 10 patients do not have access to medical therapies at home or at the hospital anymore, such as enzyme replacement therapy infusions. 6 in 10 do not have access to tests that are often a crucial part of their daily care. 7 patients in 10 have seen their appointments with their physicians cancelled. What happened in hospitals? Getting access to usual care is difficult because we were overwhelmed by COVID-19 emergency needs. Hospitals that provide care for rare diseases were often closed, and patients were explicitly told not to go to a hospital even if they were sick for other reasons than being affected by COVID-19. Drugs and materials needed for their disease care management are missing due to logistic delays and transport difficulties for the lockdown in some regions. But also the fear of COVID-19 contagion was an obstacle to receiving care. Patients did not go to the hospital because they were fearful themselves to catch COVID-19 virus. Nevertheless, in the surveys, patients are praising their additional effort made by their healthcare professionals to provide care for their rare disease, despite hurdles generated by the COVID-19 pandemic. The COVID-19 pandemic is not over yet. How to manage patients with their rare lysosomal diseases during the pandemic? I will report our experience in the Regional Referral Center for Lysosomal Diseases at Modena University Hospital and in Italy. Italy is the first European country that faced SARS-CoV-2 disease after China, with more than 230,000 cases out of 60 million Italians, mainly in northern Italy, where I'm located. 2/3 of the contagions were in northern Italy. We had 34,000 deaths due to SARS-CoV-2 disease and more than 160 dead physicians. Many workers in the health system also were infected by COVID-2 virus, which means that they couldn't work. The country lockdown took place on March 13, 2020, and our system is a public system, public hospital that were overwhelmed by intensive work for COVID patients and particularly in intensive care units. It was an unknown disease and we didn't know the therapies. Most internal medicine departments care for COVID patients even now, and so couldn't take care of other patients, chronic and rare disease patients. We stopped the programmed care activities. Some hospitals had to close due to local outbreaks. And at the beginning, personal protection equipments were not available on the market. But the problem was the spread of fear, stress, risk, and danger feelings. The next question is, are Gaucher and Fabry disease patients affected by SARS-CoV-2? These are the most important cohort that I follow in my hospital. So we had an Italian surveys among physicians treating the patients with lysosomal storage disorders, mainly referral centers, because we were wondering, did our patient with Fabry and Gaucher get the infection? Well, Italian Fabry and Gaucher patients have not been affected by the disease as far as we could ascertain. A few patients had the COVID-2 virus contacts, but their serology tested negative. May lysosomal dysfunction play a role in preventing the infection? Other talks will address this issue. But we know that our patients were particularly segregated and they stay at home and were very careful because they were frightened by the COVID-2 virus. Most hospitals and their centers in my area are still open for ERT infusions. Some patients missed the infusions of enzyme replacement therapy, both at home and in the hospital, because of their fear of the COVID contagion. Many patients now can work at home, so they still stay at home. Some did not go to work or left the work for own safety. A European survey among physicians treating patients with lysosomal storage disorders and mainly Gaucher led to the same results, and this was shown at the European Working Group on Gaucher conference on June 15, 2020. How we manage the continuity of care for our patients with the lysosomal storage disorders during the COVID pandemic. In Modena, Italy, we started to have more frequent telephone calls to patients to ensure wellness and adherence to therapies. We started to enhance the use of telemedicine, at least for some exams, or for a face and in-person check. We gave them very soon information about the preventive measure to avoid COVID-19 infection, like frequent hand washing, such as hygiene, masks, alcoholic solution, physical distancing. We supported our patients to ensure self-management and resilience due to the lockdown, because this disrupted families. People were alone at home with relatives maybe in another area, in another place or region. The psychologist consultation, both by phone and video call, were allowed for some patients. We delayed non-urgent or the follow-up usual investigation, also because there was a shutdown of many facilities. We provided a safe, protected environment for ERT infusion. And we established, due to the local government in my area, a full digital procedure for prescription and drug delivery directly to patients' home, with the help of pharmacists, volunteers, Red Cross, civil protection. The video call consultation was also very important. I refer here particularly my experience with Gaucher patients in Modena, Italy. The fact that digital prescriptions were directly sent to the pharmacy allowed the drug delivery at home and no difficulties in cares. For patients with the Gaucher type 1 on IV, the ERT was possible sometime at home, if available, or in hospital. A few patients missed some infusion because they didn't want to admit any nurse or other person in their homes for the contagion fear. The safe access to hospital meant masks for everybody, personal protection with equipments, temperature control at hospital entrance, and before people could come to our unit, a triage was checking for symptoms and fever at home. Patients on oral substrate reduction therapy had a great advantage in adherence to therapy. They had no interruption because we could guarantee the drug supply, and altogether they reported better quality of life. The questions with these patients were mainly concomitant therapies. Acute medications are such as antibiotics, or chronic medications such as antidepressant medication, because the need of antidepressant in these months was increased. And we faced also the problem, if our patient with Gaucher type 1 gets the infection, should they use the regular treatment that we are using for other people infected by SARS-CoV-2 disease? We inform the patients and their physician of the drug-drug interactions with eliglustat and oral substrate reduction therapy. Remdesivir could be used because of real clearance and no DDI, whereas hydroxychloroquine and azithromycin that were used in trials in my area and in my hospitals cannot be used together with eliglustat because of the prolonged QT on EKG. The advantage of oral substrate reduction therapy during the SARS-CoV-2 emergency in our heavily hit regions was underlined by patients on SRT because they could better manage their therapy and the lockdown. Now we are facing an opening, a reopening, the relaxing confinement phase. What should we do? We started to open mostly the facilities and also the hospital. Health policy makers should implement measures to protect members of the rare disease community. We should monitor the spread of SARS-CoV-2 virus mainly in a high-risk population and people living with a rare disease. We will provide, if available, access to a vaccine or other prophylactic treatment when they will be on the market, as for all the fragile, chronically ill persons. Schools, educational facilities, and resource centers should be prioritized when relaxing confinement because they are essential for both patients and their family and caregivers because people don't know how to manage their family and their children. Guaranteed access to COVID testing and personal equipment for protection for people who need it most, including the serological testing, and we are doing this now. We think that the health policy makers should implement the test, trace, and treat policy. Encourage, allow working from home for all patients, and implement safety in workplaces, public spaces. Be careful about physical distancing measures because we still have cases. Transport public facilities, we hope to have guidelines to minimize the risk of infection, and we will continue online consultation. At the beginning, we felt it was a band-aid. It's not, it's a great opportunity. And so we will integrate such telemedicine tools into routine care practice with the necessary clinical assurance and data protection safeguards. The social support is important and will still be provided by social workers, psychologists, and institutions. In conclusion, I think that most patients with lysosomal disorders during the COVID pandemic did not interrupt their therapies in Italy and mainly in Modena, but still had detrimental experiences during the pandemic and a lot of anxiety, stress, and fear of danger. In Modena, Italy, we set up useful procedures to manage patients with lysosomal storage disease and continue their care. Telemedicine is not a silver lining, it's a great opportunity. After the lockdown, in the relaxing confinement phase, we need the procedure and the health measures to care for the rare disease community, as COVID-2 is still among us. I thank you for your attention, and I let you with the view of my hospital in Modena, Italy, and of Modena Tower from the 1100, and I'm here to take your comments and questions. Thank you very much.